Hello again, everyone. My name is Marty Guthmiller. I'm CEO of Orange City Area Health System, bringing to you today a special COVID-19 community briefing. If you can remember back, I've been talking about keeping your engine tuned and that life keeps on happening regardless of COVID. Well, this week I'm living proof of that. I'm living proof that root canals are still necessary. I had that on Monday. Kind of looked like a chipmunk for most of the week. And of course, I've had my visit to dermatologist this week, again, which reminded me that things keep happening. And you do need to keep that engine tuned and keep on living. And so I'm living proof of that for this week. I wanted to give a special briefing today with a couple good news items to end the week with. First of all, a brief rundown of some statistics. They continue to go in our favor. The Sioux County 14-day average is 8.5. The 7-day average is 5.5. So really dropping down significantly. The positivity rate per 100,000 population is now under 100 at 91.7. That's an 87% drop in that particular rating. Comparatively, the state of Iowa is at 195. So we're significantly below that. Again, the state at 195 per 100,000 population, and that's down only 0.5%. The Iowa 14-day average is 10.0 and the 7-day average is 7.6. So all of those numbers continue to go down. The last statistic that I'm going to share with you today is also a good one. We only have 2 Sioux County residents hospitalized currently with COVID diagnosis. So 2 hospitalizations in Sioux County or with Sioux County residents, and that number was 6 when we spoke on Monday. And so the other bit of good news that I'd like to share with you is that this morning we received a notice of some additional doses being made available, anticipated to be received next week. That makes our 1B known allocations, and that's 1B as prioritized by 65 years and over, to be in the 250 range for next week. Now, we don't have those doses yet, but we're anticipating that to be the case next week following the good news that we received this morning. And so that should take care of our allocation or our appointments that we have for next week. And we continue to keep those lists going. Speaking of lists, I think it's important that we keep what 250 doses means in perspective. Currently, we have about 600 appointments on our books. We also have about 400 on a list that will be called in the order that we put them on the list after the 600 appointments are fulfilled. So that gives you an idea as we progress week to week how we're going to be able to attack this. All of this, of course, is dependent on the supply that we get, and we will know the week in advance on the Wednesday prior. So each Wednesday we find out approximately what we will receive for the following week. Now this week happened to be, we received a notice this morning on additional doses, so that's always welcome, but that's probably not typical. So again, each Wednesday we will know the allocation for the following week. It's also important to understand that in our database alone, with our patients, we have about 3,000 in the 65 plus category. So not all of those 3,000 will require being on a list or require vaccination, in part because they might be in a nursing home somewhere. But nonetheless, that helps you keep in perspective what 250 doses next week means to our overall timeline for getting vaccines in people's arms. So you can continue to get on a list at this point by one of two ways. Calling our clinic at 737-2000 or by going to our website and filling out a form. Either way is fine. Either way gets you on a list, and that list will be followed up in the order that it's compiled. And again, the timing of that is going to be solely dependent on when we get the vaccine. I want to also mention that if you are not a patient for Orange City Area Health System, we urge you to get on a list or get an appointment with your provider at your own home location. They have your medical record. They know your history, such as whether you may have received advanced therapeutics or not, because that's important, and you should not receive the vaccination if you've received an advanced therapeutic. And again, what's the definition of that? And your health provider would know that the best. Also, your medical record is there, and that would provide the long-term validity, the long-term reporting, the long-term assurance that you'll know that when you have to prove that you've had the vaccine, that it's documented in your medical record. I think that's being underemphasized today, and it's something we have to think a lot about, because we are going to have to prove this whether we get on an airplane or to get out of the country or back in the country, all those kinds of things. And to have that a part of your medical record is going to be important. So we just urge you, if you're not currently a patient of Orange City Area Health System, to seek the vaccination from your own provider. The vaccine right now in Sioux County under the 1B category, which begins on Monday, is still limited, or still we are prioritizing it by the 65 plus category. The stats still show, the demographics still show, as we've been talking all along, that 92% of deaths are in the 60 and over category. And so we are prioritizing that population. We wish we could get it to everybody, but that's what we're doing. And we believe that the statistics clearly show that, and the justification is very clear in that. We pledge, obviously, the supply of the vaccine is a very fluid one, and will be for the weeks and months ahead. We pledge, however, that we will get the vaccine injected. We'll get it in people's arms, as they say, as soon as we get it in, and that will almost assuredly be the week that we get it. Unless we just get a massive amount of doses that we can't give. But even with some of the extra doses that, like this morning, we were notified we're going to receive, that's not too many for us to give. So this is not about the administration of the vaccine, it's about the supply of the vaccine. And I can't emphasize that enough. Also, there's some concern out there that, will you have the vaccine available for my second dose? And we refer to these to have consistent verbiage as the primary dose and the booster dose. The state, in all of their allocations, so let's just say they allocate 100 primary doses to us. That means that they've also held back 100 booster doses for us. And so far, that's been delivered accordingly. And so the primary allocation is kept separate from the booster allocation, and we're confident that that will continue in the future, and so that there's no concern that you should have, no worry that you should have, that the booster dose will be available. If for some reason booster doses are not received, we will simply divert the primary dose to give to the booster dose. So we're not expecting that we need to do that. We have not had to do that so far, but I just wanted to make a point of that as well. So it's been quite a week again, very fluid one, vaccines, no vaccines, all that kind of information, dermatologist visits, dental visits. So life goes on. and we encourage you to stay strong through all of this, to stay vigilant, be careful, but live your life. Keep that engine tuned, and above all else, stay healthy. Thank you for joining us today, and we look forward to future briefings, probably next Monday. Thanks, and have a great weekend.